one day I was walking from where I work out to my car, and one of the girls that worked with me comes walk along behind me, and she goes, so she asked me what was wrong, if it was my feet or it was my back was bad. So I started talking to her, and her mom had a similar situation with her back, and she'd had problems with her back.
A little bit of pressure on a nerve tends to cause people numbness. A little more pressure, pain, even more pressure, weakness. And Mr. Hoffmeister, had developed a foot drop on one side, and then he developed a foot drop on the other side as well. So he was having true weakness.
So do you have narrowing of your back spine, of whatever the hole is, vertebrae, and that it's tightening around your sciatic nerve and your other nerves and your spinal column, and that's why you're having so much pain and you're having a hard time walking?
Yes, and it was a little scary. But the pain was so much that it didn't bother me at that point. I just wanted to get it over with.
And that's a situation where there actually is some new technology which we just, up until about 5 years ago didn't have, and that's called IAFLEX. So basically that's just a way of putting a little file out into the foramen, which is a passageway that the nerve is passing through, and you can use that file in a foramen that's too small to file it open and make it bigger for the nerve. So, that's a really sort of simplified way of describing that.
It was nice finding out that what was wrong, what could be done, and there was an end to it, because it was just overwhelming. It would affect me, on a psychological level too, because I couldn't do stuff that I wanted to do, and if I tried to do anything, it was just pain all the time. So when Dr. Weaver told us what would happen, and that the relief would come and stuff, it was really reassuring, and it just opened everything up again. Then all it was waiting for the day to come.
Originally, when patients make appointments, they might be hesitant, they're nervous, they're scared, because obviously they're coming to a neurosurgeon. They don't know if they need surgery, or maybe they've never been to a specialist before. And typically when they leave, they feel relieved because the doctors have given them some hope. I think after the patients leave, if they are surgical and they've gone through surgery, they're really thankful. And I get to talk to them after that whole process and get the feedback that our staff was wonderful, that the doctors were wonderful, that they're feeling much better, and even though they were scared when they originally came in, they have their life back.
And he's still, working with physical therapy to try and, build those muscles back up. As soon as you don't get good signals to a muscle, the muscle will atrophy very quickly. So my hope is, over the course of maybe the next 6 months to a year, that he'll get a good, return of that strength. It may not be perfect, but hopefully it'll be 80–90%.
My life now, after the operation, is a lot better. I don't have the pain now. I don't have a constant pain. I can go out and do what I used to do in a little more limited way, in that I'm building my muscles up. But I can work on my car when I have to. If it breaks down, I fix it. I can change light bulbs in the house. It's the little things. I can go up and down the stairs without my son at my side. I regret waiting to how long it took finding out what was the problem. I was ready instantly as soon as I found out to take care of the problem, no matter what the risk involved in the back surgery. But the main thing is I didn't know what was happening. I didn't realize it was my back. I thought it was my hips.
There's boatloads of people who have got horrible weakness that's developed because they've left a nerve be compressed, and then next thing you know, they're having a hard time holding onto a coffee cup, or they're tripping over their toe, and when it progresses to that level of pressure on a nerve, there's no guarantee that if we take the pressure off that's going to be a full recovery. So if people are having arm pain, hand pain, leg pain, it would be best to see someone to get an MRI, get some tests to see what's the reason for that.